Chapter 3. Know the patient. A case well taken is half cured, one of the masters said. For a good homeopathic prescription, a great deal of information is essential, which is not needed in ordinary medicine. The homeopath must know his patient spiritually, emotionally, mentally, physically, and socially. He must give him as much time as he needs to acquiring this knowledge. He must not prescribe anything but placebo in a chronic case until he has it. In an acute case, he must know the same factors in so far as they affect the acute condition. Let us suppose that a new patient comes into the office of a homeopath. What is the procedure? First, the physician must be receptive, like a photographic plate ready to receive the image of the patient. He must clear his mind of other preoccupation and of previous opinion about the patient. He must be tranquil, cordial, and after the first greeting and question, "What brings you to see me?" or "Tell me what is that troubles you," he must be silent. Second, the physician must allow the patient to tell his own story in his own way. Questions or interruptions of any sort derail the patient at this stage and may cause the doctor to lose essential information. Third, the physician must observe from the moment the patient enters. The office should be so arranged that the light falls on the patient. The main point to be noted are: first, the personality of the patient; second, his apparent state of mind both in himself and in relation to the doctor, whether depressed, shy, suspicious, secretive, afraid, ashamed, etc. Third, his apparent physical status, signs of disease in gait, complexion, difficulty in breathing, etc. Fourth, traits of character as shown in dress, cleanliness, neatness, pride, etc. The physician must record every item which seems to him important. In the words of the patient, both in what the patient says and in what he himself observes, in a column at the left of his paper, leaving at least an inch blank between the item to the subsequently filled in as the patient reverts to that subject, or later when the physician questions about it. He may prefer to put facts pertaining to the history on one sheet, or in one column those pertaining to the actual physical symptoms in another, and the mentals in the third, but this requires experience and adaptness. It is safer for the beginner to list them all as they come and sort them later in the working out of the case. Fifth point: when the patient has come to a full stop, the physician may say, "What else?" and by waiting elicit much more and often much more valuable information. If the patient is reticent or gives only brief and objective data, and the physician is unable to persuade him to give more, this passive method may have to be abandoned in favor of active questioning. The object is to drain the patient dry of what he knows of himself. If the patient is loquacious, time may necessitate the prevention of irrelevancies, and the uttermost track is needed to keep him on the main track and yet not lose the important sidelights. Sixth point: when the patient is through with his story, a few remarks by the physician may be in order as to the aid that can give through our remedy and the necessity of special knowledge of the patient as a whole, and many details ordinarily overlooked. This pleases the patient and ensures cooperation in the answering of often rather intimate questions which must follow. Point 7. The data needed for the ordinary medical history may hardly have been touched on up to this point and should not be inquired into even yet. If by this time the consultation period is over, if the patient is not in acute pain or distress and has not come from a long distance, a subsequent appointment should be made for the next day if possible, and the patient should be definitely told that the physician must do a complete physical examination and the necessary routine lab investigation at the next visit. Instructions for bringing a 24-hour urine specimen should then be given. This makes the patient realize that in addition to the interest of all the details of the case, the physician is going to be thoroughly scientific. Point number 8. The physician should now take up each item that he has noted on paper and get the patient to tell him more about it. When the patient has exhausted all that he can tell about each item, the physician should bring out the modalities. If, for instance, the item is pain in the stomach and the patient volunteers that it is burning and has no relation to meal and non radiating, the physician must find out what aggravates or ameliorates it, what time it occurs, its concomitants, its relation to mental states, if any, etc. When each item has been so modified and filled in, the physician must run through the list and see which of the possible mentals, generals, particulars, and modalities have not been mentioned and question the patient about each of this. Point number 9. All questions that the physician asks must be put that the patient cannot reply with a simple yes or no, but must think before answering. The physician must be careful never to suggest an answer by the form of his question and must guard against the questioning for the symptom of a particular remedy which may have come to his mind. If he has seen a fairly definite remedy picture in the patient's story and wish to cling it, he must have taken special care not to lead the patient into the answer he desires and may even suggest the opposite and watch the reaction. Point number 10. When the physician has covered the field outlined above in detail, according to the systematic outline which the no voice should have before him during the interview and which the master knows by heart, we append a suggested one. He must make sure that he has questioned the patient on every system and function, otherwise, some important detail will be missed, which might prove a keynote suggesting the study of one or more remedies. Point number 11. The mental symptoms and characteristic of the patient, which, as will be brought out in the later lectures, are the most important if strongly marked, should usually be elected last when the patient's confidence has been more fully gained. Specially tact and insight on the part of the physician are needed to evaluate the emotional cause of the disease. For instance, a few patients know that ailment from mortification might be the most important symptom in their case, or that suppression of sex needs or anger might rank as a leading cause of their illness. Point number 12. At the close of the interview, the patient must be made to feel that the physician is deeply interested in his case, that he will take the hours needed to thoroughly study up to repertorize the case, and that the special method of homeopathy can bring not only relief but also a fundamental improvement in the whole constitution, which will tend to ward off subsequent illnesses and increase the power and well being of the patient. A thorough physical examination and routine lab work or any extra test suggested by the history must be done on every new patient and at least yearly on old patients, and the patients instructed as to why they should not use any other drugs during the homeopathic treatment, what are the dangers of suppression, when they should report back, and when they may expect as the immediate result of the treatment. One other point may be valuable in knowing the patient, and that is to get the version of the immediate family or close friends. This is sometimes dangerous as the nervous patient hate to know that they are being talked over, but the wise physician must take care much contradictory evidence and arrive at more than just a sympathetic elevation of the case. By this time, the physician should have a remarkably accurate picture of the patient in his phases subjective, objective, and pathological. For this totality of symptoms, he can, by correctly evaluate the symptoms, as will be shown in the subsequent lectures, derive a true image of the patient and the remedy. Outline of taking the test. The patient story, modalities as applied to each of the above symptoms in the following order. First, causes. Second, prodrome, onset, pace, sequence, duration. Third, character, location, laterality, extension, and radiation of pain or sensation. Fourth, concomitance and alternation. Fifth, aggravation or amelioration. Time, hour, date, day, before or after midnight, periodicity, season, moon phases. Temperature and weather, chilly or warm blooded, usually chilly or warm blooded in present illness, wet, dry, cold or hot weather, weather changes, storm or thunderstorms, before, during, or after. Hot sun, wind, fog, snow, open air, warm room, changes from one to another, stuffy or crowded places, drafts, warmth of bed, heat of stove, uncovering. Third, bathing, hot, cold, or sea, local applications, hot, cold, wet, or dry. Fourth, rest or motion, slow or rapid, ascending or descending, turning in bed, exertion, walking, on first motion, after moving a while moving, after moving, car and seasickness. Fifth, positions, standing, sitting, knee crossed, rising from sitting, stooping, rising from stooping, lying on painful side, back, right or left side, abdomen, head high or low, rising from lying, leaning, head backward, forward, sideways, closing or opening eyes, any unusual position such as knee chest. Sixth, external stimuli, touch, hard or light, pressure, rubbing, constriction, clothing, etc. Jar, riding, stepping, light noise, music, conversations, odor. Seventh, eating. In general, before, during, after, hot or cold food or drinks, swallowing, solid, liquids, empty, acid, fats, salts, salty food, starches, sugar and sweet, green vegetables, milk, eggs, meat, fish, oyster, onions, beer, liquor, wine, coffee, tea, tobacco, drugs, etc. 8. Thirst. Quantity, frequency, hot, cool, or iced, sour, bitters, etc. Ninth, sleep. In general, before, during, on falling asleep, in first sleep, after, on waking. 10th, menses. before, during, after, or suppressed. 11th, sweat, hot or cold, foot sweat, partially or suppressed. 12th, other discharges, bleeding, coryza, diarrhea, vomitus, urine, emissions, leukorrhea, etc. Suppression of same. 13th, coition, continence, etc. 14th, emotions, anger, grief, mortification, fear, shock, consolation, apprehension of crowds, anticipation, suppression of same. Strange, rare, and peculiar symptoms. Third, the patient as a whole. Mental generals to be studied last for convenience. Physical generals. Physical generals. First, the constitutional type of the patient. Endocrinologico homeopathic correspondences, lack or excess of vital heat, lack of reaction, sensitiveness, etc. Second, ailment from emotions. Also see mental generals. Suppressions. Emotions discharge such as menses, sweat, leukorrhea, catarrh, diarrhea, etc. Eruptions. Diseases such as malaria, rheumatic fever, exanthems, syphilis, gonorrhea, etc. Of pathology such as hemorrhoids, fistula, ulcers, tonsils, tumor, other surgical condition, etc. From exposure to cold, wet, hot sun, etc. From mechanical conditions such as overeating, injury, etc. Third point, menses. Date of establishment, regularity, early or late, duration, color, consistency, odor, amount, clots, membrane, pain, modalities of concomitants, aggravation or amelioration before, during, or after, both physically and mentally. Menopause, symptom of. Point number 4, other discharges. Cause, color, consistency, odor, acrid or bland, symptoms from suppression of. Symptoms alternating with hot or cold, partial discharges as of sweat, laterality, better or worse from discharges before, during, or after. Point number 5, sleep, better or worse from position in, aggravation from difficulty in getting to sleep, waking frequently or early, at what hour, somnambulism, talking in sleep, dreams, restless during. Point number 6, restlessness, prostration, weakness, trembling, chills, fever, etc. Point number 7, aggravation and ameliorations applying to the patient as a whole. Point number 8, objective symptoms such as redness of orifices, superfluous hair applying to the patient as a whole. Point number 9, pathology which appears to the patient as a whole, such as tendency to tumors, veins, cysts, polyps, warts, moles, individual and family tendency to a certain diseases or weakness of specific organs or tissue, frequency of catching cold. Mental generals. First, will, loves, hates, and emotions, suicidal, loathing of life, lasciviousness, revulsion to sex, sexual perversions, fears, greed, eating, money, emotionality, smoking, drinking, drugs, dream, homicidal tendencies, desire or aversion to company, family, friends, jealousy, suspicion, obstinacy, contrariousness, depression, loquacity, weeping, laughing, impatience, conscientiousness. Second, understanding, delusions, delirium, hallucination, mental confusion, lost time sense, etc. Third, intellect, memory, concentration, mistakes in writing and speaking. Fourth, quick review of the condition of every system and organ, beginning with the head and following order of the Kent's repertory. Fifth, past history of the patient in 7 years period. Sixth, family history. Seventh, physical examination and laboratory tests.